More and more people are warming up to medical marijuana. 25 states plus Washington, D.C. have already enacted laws to legalize medical marijuana.
And a new survey out today reveals 75% of Americans say it's time for medical marijuana to be legal. Well, CBS News medical contributor Dr. Holly Phillips is here to talk a little bit about this. 75% say that they're ready for. So I know there are a lot of sort of anecdotal stories about how medical marijuana has improved the lives of people who have, particular illnesses. But what about the research? Does the research back that up?
Right. So we do have some evidence that medical marijuana has benefits and that it works, but we need more. So right now we do have small studies. There are some strong international studies out there. We have a lot of anecdotal evidence where one patient will say, this worked for me with this one condition, but we need to know not just that it worked for that one patient, but that it works for the majority of people who have that condition. So we're waiting for the real gold standard, large randomized controlled trials. One of the interesting reasons, though, that we don't have those studies is that right now medical marijuana, actually since 1970, marijuana has been a Schedule I substance based on the DEA rankings. So there's 5 schedules. Schedule I means it's the most dangerous drugs with the highest potential for abuse and no medical use. What that means from a research perspective is that it's hard to study. Scientists have to jump through a lot of legal loopholes. They've got to get approval from 3 different federal agencies, and so the red tape is so daunting and heavy that many times they don't end up studying it. So we do need to change it. There are people lobbying the DEA, including the American Medical Association has asked the DEA to consider changing that schedule, lowering it to Schedule II. It won't make it legal, but it'll make it easier to study.
What are some of the common ailments medical marijuana is treated?
The main reason it's being prescribed right now is for chronic pain. That pain could be from headaches, it could be from cancer. There are other uses. It's used to treat nausea and chemotherapy. It's used to treat seizures. It's being studied for the treatment of post-traumatic stress disorder in veterans. That's an international study here, Spain, Israel. It's also used in just a variety of other settings for people who have Alzheimer's disease to help to improve their appetite in the end stages of the illness. So, and there are a lot of, as I said, anecdotal and individual reports where people say this really helped me. We're just waiting on the big data.
So we're talking about a range of symptoms, a range of ailments. Do we know anything about how marijuana works?
Yeah, we do. There are a couple of different compounds that are the most active. They act on neurotransmitters in the brain. One is called THC. That's responsible for making you feel more relaxed. It improves your mood. It controls pain. Another compound is called CBD. It's an anti-inflammatory. It also controls pain. But I do think one of the interesting aspects here is that the increase in acceptance, I believe, for the general population may be rooted in our greater understanding of the dangers of prescription painkillers. Right now we have an opioid epidemic that many people, hopefully everyone, is aware of. And while the prescription painkillers, the opioids OxyContin, think Vicodin, Percocet, they kill thousands of people a year. Every 19 minutes, someone overdoses from prescription drugs. With medical marijuana, while we can't say definitively that it works for everything, we can say it is a safer option for the treatment of pain than those prescription drugs. The lethal overdose with medical marijuana really isn't a concern. It has been documented rarely, if ever, whereas every hour someone dies from the prescription opioids.
That makes it even more confusing as to why it remains a Schedule I drug without, at least some exceptions.
I mean, we know that there are some risks, but it just seems unbelievable to a lot of people that all those opioids that you mentioned, 19 minutes, that is an incredible statistic.
It is.
I just can't imagine why it's still listed like that.
Well, and another interesting thing that we found, one study found that for people, for the states that have legal medical marijuana, they have 25% fewer opioid overdose deaths. It suggests if people have the option to try or use medical marijuana for their pain, they're less likely to reach for the prescription opioids and hence less likely to overdose.
Dr. Holly, isn't alcohol worse for the body than medical marijuana?
Well, I mean, it's hard to, it's all about degree and how much you use, right? After a certain period, if you take in too much alcohol, nothing is good for you. But really what we have to focus on here is medical marijuana, the dangers of lethal overdose with it are very, very low. It does have some downsides, as every drug has effects and side effects. Smoking medical marijuana can hurt your lungs, it can cause anxiety, it can increase your heart rate, but still, when we think about death and serious side effects, medical marijuana just doesn't have those risks.
Got to start
That's
exploring
what I hear.
it.
I've heard that. I've heard that from you, Dr. Holly.
Dr. Holly Phillips, thank you. We're going to wrap this up.
Always.